Carmen Pacheco Jones, crisis response advocate, talks about her experience through the COVID-19 pandemic and the importance of honoring the Black experience in spaces of wellness.
My name is Carmen, and I wear many hats. At the onset of COVID, I was working in public health and serving as the Black and African American Health Initiative specialist with Spokane Regional Health District. In that work, and especially in a predominantly white community, I was extremely stifled in what I can do to elevate Black wellness. I had the opportunity to develop my consulting business that's centered around Black mental health. I engaged in that. At the same time, my son was experiencing mental health issues, and we did lose him to suicide about 6 months into the pandemic. And as he was a young man, a young Black man, just seeking help, and he was not afforded that help. I then began consulting with Providence Health Center. One of the issues that they had brought to me was with the PHQ-9, which is the centralized behavioral health assessment tool used in every behavioral health and medical environment, healthcare environment. And the numbers, the statistics were so stark, and that Black individuals tested the highest in the PHQ-9, but had the lowest referral rate into services. And what we discovered throughout those conversations is that within our Black communities and African American communities, mental health does not exist in a white framework. It does not exist and set within a space of predominant whiteness where, we are, racialized. We looked at different forms of where Black individuals, receive their mental health and mental wellness. We created, programs that allow for, a different form of a service provider model, including that sometimes our wellness comes when we're just in community. That is mental health. A microaggression-free workplace that is Black owned and Black serving and understands, the racialized tensions and gaslighting that, happen within the workplace, that honors individuals when they have a loss. I developed that within my workplace. We are a Black owned, Black serving organization, specifically focused on Black maternal health and Black wellness within the family unit. And I'm really excited that, we ourselves now are becoming a behavioral health agency, and that we're going to be able to carry our mission and our values and honoring the Black experience within spaces of wellness, as opposed to in our, white centralized system models. As we continue to see, how COVID has impacted our Black community. And so we have to continue to be courageous in our advocacy, courageous in our stepping into spaces where, historically we have not been welcome. This understanding that, we need to be in those spaces as well, and supporting organizations such as Momentum that are doing such amazing work that I have had the honor to work collaboratively with in the past, and so honored to be here today and to share my experience and my story. And hopefully to continue to work this good work across our state.